Gastroesophageal reflux disease (GERD) is a common condition in which the stomach contents move up into the esophagus. Reflux becomes a disease when it causes frequent or severe symptoms, so it may also damage the respiratory tract. So let's first talk about the symptoms of GERD. Main symptoms of GERD is heartburn, often described as a fiery feeling in one's chest. And we can also talk about regurgitating sour or bitter liquid to the throat or mouth. So the combination of heartburn and regurgitation is such a common characteristic of GERD that testing may be unnecessary. Other symptoms of GERD include: number 1, non-burning chest pain, which is usually located in the middle of the chest and radiates to the back. Number 2, difficult swallowing, also known as dysphagia. Number 3, we can also talk about a typical reflux of symptoms related to the respiratory tract. These symptoms include sore throat, coughing, increased salivation, and shortness of breath. Let's talk about the diagnosis of GERD. So a diagnosis of GERD starts with a thorough examination during which you describe your symptoms and medical history. So if the typical symptoms of reflux disease are present, including heartburn and regurgitation, your doctor may begin treatment with performing specific diagnostic tests. However, tests may be taken if your symptoms are typical, if the severity of the reflux raises concerns about esophageal damage, if symptoms do not respond to initial treatment. So diagnostic procedures of GERD include: number 1, upper endoscopy. Number 2, reflux testing. Number 3, esophageal manometry. Number 4, barium esophagram. So let's first talk about upper endoscopy. So this procedure allows your doctor to examine the lining of your esophagus, stomach, and first part of the small intestines. So it is the best test for evaluating reflux-induced esophageal injury and diagnosing esophagitis and Barrett's esophagus. It can also help diagnose an esophageal stricture. Although 10 to 20% of people with a reflux will have an abnormal finding during endoscopy, the procedure is necessary to evaluate the potential for complications. Your doctor may also want to rule out other serious conditions that mimic GERD. So let's talk about what is done in an endoscopy. So during the procedure, you receive an anesthetic to help relax your gag reflux. Secondly, you may also receive pain medication and a sedative. Thirdly, you lie on your left side, referred to as left lateral position. So then your doctor will insert the endoscopy through your mouth and pharynx into the esophagus. So this endoscope transmits an image of the esophagus, stomach, and duodenum to a monitor that your physician is watching. Number 2, reflux testing. So in reflux testing, a wireless pH testing allows your doctor to evaluate your reflux activity over a 48-hour period while you continue your normal activities. So let's first talk about what is done in this procedure. Firstly, your doctor performs an endoscopy and places a small chip in your lower esophagus. Secondly, the chip records the acid level in your esophagus for 48 hours. Thirdly, the chip transmits your acid level to a wireless recording device that you wear around your belt. So the data from your recording device can gauge your reflux severity. Number 3, 24-hour pH impedancy. Here your doctor may order this procedure to evaluate your reflux. This procedure monitors your pH level for a prolonged period. So during this procedure, your doctor places a thin flexible catheter with an acid-sensitive tip through your nose into your esophagus. So this catheter is placed in separate recording spots to evaluate the flow of liquid from stomach into your esophagus. Then the catheter stays in your nose for a period of 24 hours. So your doctor is able to evaluate whether you have GERD, the severity of your reflux, the presence of non-acid reflux, and the correlation between your reflux symptoms. So this procedure also helps in the design of the course of treatment. Number 4, esophageal manometry. So during esophageal manometry, your doctor places a pressure-sensitive catheter into the esophagus. Then the catheter evaluates the strength and coordination of your muscle contractions. So it also tests the strength and relaxation function of your lower esophageal sphincter. So you should remember that esophageal manometry is an essential part of the assessment process prior to anti-reflux surgery. Number 5, barium esophagram. This is the most common procedure to test for GERD. During this procedure, you swallow a contrast solution called barium. So the barium you've swallowed coats your esophagus and gastrointestinal tract, making it easier for the doctor to detect abnormalities. After there, an X-ray is taken. So during the X-ray, your doctor looks for a narrowing in the esophagus called a stricture. So in brief, let's talk about the complications of GERD. Patients with severe reflux may suffer from further complications including esophagitis, esophageal strictures, and Barrett's esophagus. Thank you very much. I'm Muji. Please like my video, share it, save it, and subscribe to my YouTube channel.